Welcome to YARKUD International. Let's prepare for the Saudi Prometric exam. First question. A nurse who works in the surgical unit at one of the hospitals was asked by the home health care nurse to make a home visit to a patient with cholestin who had been discharged the previous day in order to give him a follow-up care and education. Which of the following nurses should do the assigned task? Okay, so this is a question from the nursing fundamental. Okay, so which nursing role will be here will be doing this assigned task? Okay, that is the question. So here they have given already the key points. Okay, home visits. Okay, home healthcare nurse. So what is the nurse called? It is community nurse. Okay, not the critical care, not the psychiatric, not the surgical. It is from the home side. Okay, home care. Home care, it will be delivered by the community nurse. So here the answer is community nurse. Got the point? So let's see the next question. 71 years old male was diagnosed with subdural hematoma. Underwent Buchholz craniotomy for the subdural hematoma days ago. Okay, so in order to detect the sign of meningitis, as one of which of the following indicates the patient has meningitis. Okay, so to know that here, subdural hematoma, there is a surgery craniotomy done. So just the days ago. So here, in order to detect the what meningitis, so what are the signs? What are the indication they are asked? Okay, so as we know, what are the signs of meningitis? Kernick sign, positive Kernick sign, positive root skin sign, and one more thing, it is knuckle rigidity will be present. What is knuckle rigidity? Neck will be rigid. Okay, neck will be cannot turn. It will be very rigid. So that is called knuckle rigidity. These three are the important signs of meningitis. Kernick sign, root skin sign, knuckle rigidity. Okay. So here they are just given negative Kernick sign. It is not the indication. Positive root skin sign. Yes, this is the indication. Absence of knuckle rigidity. No, it's meningitis. Presence of knuckle rigidity. Neck will be stiffness. That is called knuckle rigidity. Okay. So this also wrong. Glasgow Coma scale for 14 points. That is also not coming. Okay. So here the answer is positive root skin sign. Got the point? So here you have to be read the options well and you have to select the answer. Let's see the next one. A 60 years old man is admitted to the male medical ward with a coronary artery disease. The patient has a history of hypertension, stress, high cholesterol, diabetics, and smoking. His father died on myocardial infarction. Which of the following are the modifiable risk factor for the coronary artery disease? Okay, that is a question. So here they are asking the modifiable risk. What is mean by modifiable risk? It is means modifiable. You can be modify the risk. Okay. If example, the patient is having the obesity, they can be reduce the weight, right? So they can be reduced, they can be modified the risk factor. But non-modifiable means if it is family history of cardiac arrest or cardiac myocardial infarction, AMI, how can you change it? We cannot change it. It's the family history. If it is age, okay, older age, it is getting risk. So we cannot change the age. We cannot change the gender. Okay, like that is non-modifiable. Modifiable, you can modify the risk factor. Got the point? Okay, here, listen carefully. See the options clearly. Option A, age and gender. You can able to modify. No, we cannot be change the age, change the gender. Okay, so it is wrong answer. Next one, gender and diabetes. Okay, gender you cannot change. Maybe diabetes can be controlled, but the gender you cannot change. So this is also the wrong answer. So let's see the C, family history and smoking. Okay, here the smoking you can stop. Okay, we can stop the smoking. Okay, that is modifiable. But family history, you cannot modify, you cannot change. So that is not the answer. Got the point? So D, smoking and high cholesterol. That can be modifiable, right? You can stop the smoking. You can just reduce the fatty foods and do the exercise and reduce the cholesterol. Okay, so that will be modifiable. So here the option, because they have to confuse you, they have given one modifiable and one non-modifiable risk factor. So you have to be carefully select. Okay, smoking and high cholesterol you can modify. So here the answer is smoking and high cholesterol. Got the point? So like that we have to be select. So modifiable you can change, non-modifiable you cannot change. Okay, let's see the next question. A patient returned to the surgical unit from the thyroidectomy. The nurse observed that the arousable blood pressure 90/60 mm of Hg, heart rate is 108 per minute. What immediate action should the nurse take? Okay, here the question, they have mentioned the BP and heart rate, asking the nursing action. So here option A, recheck the pulse and blood pressure, administer intravenous fluid as ordered, place the client is modified, Trendelenburg position, assess the back of the neck, surgical dressing for bleeding. So which one you will do? The BP is decreasing, okay, not so much, no need for the intravenous fluid, okay. So no need to check the recheck again immediately. No, we will be waiting. So 90/60, it's coming on heart rate 108. Heart rate is slowly, it is increasing. It is still the 100, it's slow. It's just now came from the surgery. Okay. So you have to be remember there is a risk for if it is BP, it's going down. Heart rate is increasing. What is the mean by that? It is the signs of bleeding. Okay. So after surgery, so you have to be checked for the patient back, especially for the thyroidectomy patient, back of the neck, not in the only for the front we are looking. Okay, back of the neck, for any bleeding or oozing, we have to check. Okay, got the point? So here the option is D. Okay, so not the rechecking, not the intravenous fluid administration, not too much low, the BP. Okay, 90/60 is that. Okay, so here the answer is assess the back of neck, surgical dressing for the bleeding. Okay, so let's see the next one. 11 years old child has been diagnosed with type 1 diabetic mellitus. Which of the following education should the nurse explain about the exercise? Okay, so here the nurse is giving the teaching for exercise, okay, for the diabetic type 1 diabetic mellitus baby. So it is 11 years old, okay. So here the option, extra insulin is required during the exercise. Extra snacks are needed before the exercise. Exercise will increase the blood glucose. Exercise should be restricted. So which one you will teach about exercise and diabetic? Which one you will? Okay, remember for the patient with the diabetic mellitus, exercise will cause sometimes hypoglycemic attack. Okay, so exercise will be patient sugar level will be go into down while doing the exercise. Okay, so what instruction you have to do? Exercise is must, not restricted. They have to do the diabetic patient, they have to do the exercise. Okay, that is one of the treatment plan. But you have to tell the patient you need the extra snacks before the exercise. They have to eat something and they have to do the mild snacks they have to eat, then they have to do the exercise. Okay, that is the teaching you have to given while you are teaching the patient about exercise. Okay, for the diabetic patient. So here the answer, extra snacks are needed before the exercise. That is the correct answer. Okay, so you have to teach that. So this is from the YARKUD International. We are giving the online training for the all nursing examination like Prometric, SNB, Omen Pearson View nursing examination, MOH, DHA, HAD, OET, and IELTS.